efforts at the state level. All right, so welcome to our panel on systems change, efforts at the state level and community level prevention. My name is Lindsay McMurrin. Happy to be here with you all today. My colleague and friend Lisa Deputy is here as well. She'll be leading tech support. And she can be messaged directly. Thanks, Lisa. She waved there for everybody. Yeah, we just want to welcome you for joining us. We have a robust panel of amazing women presenters today, including Kelly Felton with suicide prevention from MDH, Chris Haugen, our statewide health improvement plan person from MDH, Laura Bennett, a regional prevention coordinator from DHS, and Nancy Riestenberg with Restorative Practices from DHS. And so we really invited everybody here today to think about this work in a different way. So often we spend so much time with feet on the ground doing the work at hand, which is such an important piece of this work. But we know that we need change at the systems level as well. And so when we think about systems change, it's generally understood to require adjustments or transformations in the policies, practices, power dynamics, social norms, or mindsets that underlie the societal issue at stake. It often involves the collaboration of a diverse set of players and can take place on a local, national, or global level. Today, we wanted to showcase the amazing work being done across the state of Minnesota to work at systems change. And so with that, we're going to go ahead and get started. And let me just double check here. And we're going to start out with an invitation for welcoming, for introducing our panelists in the way in which they want to introduce themselves. And so Kelly, I'll go ahead and hand it over to you.
Good morning, everybody. My name is Kelly Felton. I use pronouns she, her, hers, and I am with the Minnesota Department of Health as within the suicide prevention unit. And so I'm a suicide prevention coordinator with my role being very much at the macro level. So I run the suicide prevention task force for the state of Minnesota, as well as do all of the strategic planning for the state of how we're going to address suicide prevention. So I'm excited to be here with some other colleagues at the state level to continue to work together to figure out what we can be doing. So our unit does a lot of different things, and I will follow up with Lindsay to put some information out there of how we're doing system level change at the community level. And so of course we at the Department of Health work with other state agencies to try to really figure out how we can streamline what's happening down at the community level, knowing that all of us are having those relationships, and how do we continue to work together so that we can be stronger instead of siloing it out. So that is kind of that big macro level, but all of our system level change is really walking alongside our communities, whether that's a community coalition, whether that's school districts, whether that's the criminal justice system across the state within each county and or juvenile system, to really say, what is it that young people need? What is it that adults need to live the best life that they can? And so I'll stop there and keep it a little bit brief, and I'll bring up more information as we continue to go.
Thank you, Kelly. We'll pass it right along down the line. With Chris going next.
Hi, Chris Haugen. Excuse me. I work with the Statewide Health Improvement Partnership, or SHIP as we use shorthand. Many of you probably know SHIP. I see some SHIP coordinators who are in the room, and that's really nice to have you there. I work both with the workplace wellness strategy, and I also work with the new well-being strategy, which is kind of an up and comer, and I will tell you a little bit more about that in the next couple of questions. One of the questions that Lindsay asked us to talk about was, where do you feel like systems change? How is it important? And I took kind of a philosophical look at this. Kelly, my MDH counterpart, really talked a little bit more about systems as far as working within communities, and ditto that for SHIP. But I started talking to people about individual behavior change probably in the 80s with workplace wellness, and you could get anybody to do something for a t-shirt. And then over a period of time, I have watched people move forward and try and figure out, how do you get people to be healthier? How do you impact this behavior change? You know, in a lot of cases early on, it was just helping people understand, hey, did you know what this means about your blood pressure? There was a dearth of education around it. Then it got into more psychological. Are you filling your needs by your eating? Are you, doing destructive behaviors because of some emotional issue? Then there was sort of the whole issue around bootstraps, pick yourself up by the bootstraps and have willpower, you can do it. Which is actually pretty harmful when you think about how much more complex it is to help us make changes with ourselves and with our communities. Then the socio-ecological models started to be entered into the whole format, saying, hey, you are impacted by the people you live with, your neighbors, your communities. You're impacted by the structures, the policies that are going on, the governance structure, the white supremacy model. I mean, there's just such a bigger and bigger way that you can draw that. And then also there have been some things around choice architecture. Let's just position things in a different way in a marketplace. Let's make this more accessible and help people make the healthy choice, the easy choice. The answer for me in systems work is not one fits. The bottom line is we need to kind of borrow from several different disciplines, if you will, to help figure out what's the system to help people feel good about making their changes, and not at an individual level, but even as a family level, as a way in which we work in a workplace, as a way a community functions. So a little more philosophical, but I will leave it there.
Thank you, Chris. I appreciate that. All right, Laura.
Hi, everyone. I'm Laura Bennett. I'm the Northeast Minnesota Regional Alcohol, Tobacco, Other Drug Prevention Coordinator, or just Regional Prevention Coordinator. And I am a grantee of the Minnesota Department of Human Services Behavioral Health Division. And you actually have my grant manager, Phyllis Bankston, on with us today, too. And I am located at the Community Health Board in Duluth. And the role that we have is very much similar to what Kelly initially started describing, on working alongside communities and organizations and coalitions to create change, working to prevent and reduce and delay youth substance use, and change the community norms around substance use in our community to grow those protective factors. So I work alongside them as well. And the belief in system change for me is I've seen it to be important because of all the changes that we've been able to leverage so far, and that we can have a greater impact when we're changing how people can access resources, that it's equitable, and that we're looking at how it impacts our entire community, county, region, state, to create those broader changes. Thank you.
Thank you, Laura. Nancy.
Thank you, Lindsay. I'm pleased to be on this panel today and to be part of this conference. And I just want to express some gratitude to all the people who put this together. I know this takes a lot of work. I'm Nancy Riestenberg. I'm the Restorative Practices Specialist at the Minnesota Department of Education. And I have been working to invite schools to participate in and explore and use and understand restorative practices for a while, but these practices are ancient in that they are based in indigenous worldview and knowledge, and so they're not something new, but they're something that perhaps has been put aside, if you will, that people are wanting to come back to now. The question of why I believe systems change work is important, I think is tied up in that the fact that restorative practices is based in indigenous knowledge and worldviews. I'm on the land of the Dakota people. That land was taken, stolen from the Dakota people by the United States government. And I know that the educational system that I work for historically has provided both help and hurt to people within the boundaries of the United States. Education policy has been used in a systematic attempt to destroy Dakota culture and Ojibwe culture and other cultures across the United States. And that, in fact, informs my work. And we see the resonances, the remnants, the elements of that kind of policy and policies, educational policies and policies towards Black and Brown people within schools all the time. And we're now quite aware that what we have been doing and those policies don't work. Minnesota has really high rates of Black and Brown students and Indigenous students not graduating on time, and being suspended at a higher rate. And COVID over the last 2 years, I think, has really highlighted that the way that school operates in its regular sense is needs to be transformed, needs to be reimagined in some way. I am heartened by the fact that I have had principals call me and say, can you help me learn restorative practices because what we're doing doesn't really work, or parents who had been part of a school where the school used Circle on a regular basis, and then it fell off to the wayside because it was so hard to move online a year or so ago, asking for Circle to come back for their children, for themselves, for the way that they interacted with their families. And so I think change is hard, and it doesn't happen quickly. And sometimes you need to be in a really difficult position to really move towards change. But it's apparent that in order to teach children, we have to be in relationships with them. And so we're hoping to help schools change to a much more relationally based structure. I'll pass it back to Lindsay.
Miigwech, Nancy. I think for those of us who were able to join our keynote speech today too, we heard a lot of those same elements being talked about. And I think that's so critical to understand. One of the learnings I've taken along the way in my work is that if we don't feel safe, if we don't feel connected, no learning is going to happen, right? So safety plus connection equals learning. And that doesn't only apply to our students, right? That applies to all of us as adults too. And I so appreciated Jerry and Wendell underscoring the importance of using restorative practices and this relationship-based mindset with everyone. And so I'm good for that. Our next question that we will go ahead and pose is to talk a little bit more about your project, your work, and your approach to it, and how it might look different in response to the needs of your community. I think a big part of moving away from the Western model of the way things are done is to not think about it as a cookie cutter approach, right? We know that we need to adapt based on the needs of the people we're serving. And so we invite you to talk a little bit about that, how it's feeding into this larger viewpoint of systems change, as well as being raw and honest with any challenges and learnings and adaptations that you've had to make along the way. And so I'll turn that back on over to Kelly. Before Kelly begins, I should mention, please feel free to post any other questions as that come up as our panelists are speaking in the chat. We will reserve those for the Q&A period afterwards, but I'm the kind of person who needs to write down my question in the moment or I lose it. So we just welcome that as well. Kelly?
Yeah, thank you, Lindsay. COVID has allowed for us to start thinking about our work in a little different way. I think that this shared experience that we've had over the last 2 years has allowed for us to kind of say, what are we doing? And policy and system change is always going to be the end goal. But one of the things that we're starting with is really starting to talk about our overall health and wellness in a very holistic way. And so we're doing that so that we're working across the social ecological model to start with the individual, knowing that people are hurting right now. We know that. We're seeing that. It's been not just for our young people, but across the lifespan. And there's definitely disparities to kind of highlight what Nancy was saying for different subgroups within our state. And so we're really trying to say, like, what does this mean? And how do we start figuring out what we can do as a community, as systems to better support people. And so we're really taking the approach of we come as humans, and as humans, we are involved in a lot of different systems and relationships, and we have to understand that first. And so we are working, like I said, right alongside communities, knowing that every community is different. How we approach topics such as mental health and suicide is very different, depending on our own personal beliefs, depending on our own stories and hurt and pain. And so when we've been working with communities, we have to do a yes and approach, which is not always what I was taught when I was in my previous field of substance use prevention. Of we need to go upstream. But the problem is we can't just go upstream in the problems that we're seeing and facing today. So we're doing a yes and. Individually, what can we do to support ourselves, our peers, and then say, and as a system, what is it that we're going to do? And so we are working across communities programmatically, doing strategic planning over the course of an entire year to walk alongside them, to say what are the issues that you're having within your community, within your systems, within your policies, within all of those things at the local level, knowing that as a state agency, there's not one thing that we can do that's going to change the struggle that we each have, whether that is financial, social determinants of health, et cetera. So we're really trying to localize it. And so we're doing that alongside communities. That's how we're working with our grantees as well, is to really kind of come alongside and say, what's happening here? Where's the struggle and pain? Are there trends that we can start looking at to understand what systems are causing some of those disparities? And or what are some things that we can do to promote health within workplace wellness, like Chris has also mentioned as well. And so doing that is hard. It's really hard work. I was the community organizer. That was my first real world into the prevention world. And it's still to this day one of the hardest jobs I've ever had. And one of the approaches too that we're taking is everybody and I can only speak to my own experience in rural Minnesota, but it's the same people doing the same work. And so that's why we're trying to start partnering. So we're partnering with children's collaboratives and like with Lindsay's work, and we're partnering with substance use and misuse prevention coalitions. And we're partnering with our SHIP coordinators. And we're partnering with our schools to say, in the end, our risk and protective factors that we're trying to change are pretty much the same, right? If we really want to like get rid of all of the specifics, in the end, those social determinants of health and those different things that we're trying to work on are the same. So we're really trying to also try to align with others that are already doing it. So when we think about system level change, it's not just about the policies and system change for us, it's also those relationships and that coordinating at a community level that has to happen. Otherwise, we're going to continue to silo. And so we're really kind of taking that approach of walking alongside, getting in there to say, what does this mean for your community? And then working with them on policy level system change to say, what is really happening and how can we do this more collaboratively? So I think that it's a yes and 100% yes and approach with everything that we do. We do some work within our suicide prevention unit, specifically within systems like we work with the Department of Education on the comprehensive school mental health. We also work within our juvenile justice system to change policies and systems for those that are detained from a criminal offense, and really trying to say, like, what can we be doing better to approach mental health and well-being from that holistic perspective so that our systems can get transferred into those communities as well. So lots of challenges when that comes to it, but I'll stop here and allow for other people to share, but there's definitely some shared challenges across the 4 panelists as well.
Yeah, Miigwech, thank you, Kelly. I think it's so important to point out, right? The basis that it all comes back down to is relationship. And again, there's so many shared risk and protective factors. And I so appreciate that approach in thinking of prevention across the state of Minnesota and across so many different sectors and ways of being and seeing the issues for what they really are. Much appreciated. And I'll turn it over to Chris.
Thank you. It's really fun to be sitting back and reflecting, and Kelly just makes me understand even more how you and I are walking very parallel. And what we're trying to do is even encompassing physical health, nutrition, physical activity, reducing commercial tobacco use, and looking way upstream from the prevention facts. What has happened is over 10 or 12 years ago, the state legislature said, hey, we'll give money to MDH to run the statewide health improvement program. So it's legislative funds. Every couple of years, we have to kind of fight for our existence. And we work with 41 different local public health grantees. So the work is going through local public health folks. And some of you are local public health and probably know who your SHIP coordinators are. And the mandate for that originally was reducing chronic conditions and saving healthcare costs. Well, you know, over 12 years, if you think about that original piece around reducing healthcare costs, we have been able to show some changes. But I think even more, we're building the systems in order to help everybody make the healthy choice the easier choice. And so that you actually have a choice in order to be able to choose healthfully no matter where you are. We work in several different settings. We work in a community setting, in a workplace setting, in schools, in healthcare. We work with healthcare clinics and mental health clinics and all kinds of different healthcare situations, and even childcare. And so our goal is really trying to create sustainable systems. That's where the policy systems environment work comes in order to give people more access to local foods, to be able to help them understand social determinants at a deeper level, to help communities and even economic development groups say, hey, how do we make our community a choice place to live? That's a real interesting economic engine to be able to kind of consider is as important to people as well. So what we've really done is really try to give all the control to local folks because they know their communities best. Community can be defined as small as a town. It could be a neighborhood within Minneapolis. It could be the LGBTQ community that's up on Lake Street. I mean, it could be a whole range of different ways. It could be the whole 5-county area in West Minnesota that we call Quinn, which encompasses 5 different counties. So we provide these parameters, and then the local public health people go, hey, let's look at our community health assessment. Let's look at the issues that our area is facing, and then let's figure out how to go deeper and try to create projects and programs and systems that can help create more sustainable change. This means we don't do community meals, which might be a nice social connection thing, but there's no policy and systems environment kind of thing with it. What we work more on is, and especially the pandemic highlighted food scarcity related issues, a lot of food systems related work as it connects with farmers markets and community gardens, things like that. Working with nonprofits to help them kind of advance and synergize some of their efforts. That whole come alongside piece is a place where we really are trying to say, don't reinvent the wheel. You've got incredible things going on. How can you as a SHIP person assist with some of the sustainability of the work that is being done? And maybe offer some evaluation or some other environmental supports that can help. We've been really instrumental in helping to communities create bikeable communities, walkable communities, really trying to get people to move more, recognizing that transportation is an equity issue and how important it is for people to be able to get to work and get to the post office and get to groceries, and building that infrastructure that helps us all function better on a daily basis. The well-being piece was just added in the last 2 years due to some good changes in statute. And so what we've really been doing is looking at how do you look at resilience as a community? What are the positive mental health things that you can be doing? And that's how Kelly and I have been starting to talk a lot more. We know that in 80% of the community health assessments that are done by counties, mental health ranks in the top 5 of issues, which is super, super concerning. And even in the last 2 years, we've seen just a huge outcry for more supports. Doesn't mean that we do anything with mental health access or treatment, but what we can do is say, what are the protective factors in your community that you can build up? How can you reduce the stigma around mental health? And how can you create positive relationships and outcomes for people in all the different settings in which we work? So I could go on, but I will stop.
Miigwech, thank you, Chris. Laura.
Hi, everyone. I will share some information about the system I'm a part of. So the regional prevention coordinators are part of a full system with the Minnesota Prevention Resource Center and Substance Use in Minnesota, all funded through the Department of Human Services Behavioral Health Division. And there's information about all of ours. The regional prevention coordinators really work with the coalitions, community organizations, people interested in creating change around substance misuse to figure out where do you start? How do you pull people together? What do we do to create that plan? And it's very inclusive with others throughout the community and the different projects. There's a lot of collaboration with those that are working in SHIP and those that are working in restorative justice and those that are working in mental health, and some communities even with addiction treatment resources and other areas and recovery support. So it varies by community, and our work is definitely customized for the community, listening to what's happening there, taking the lessons learned from other communities and seeing what can we learn from each other, how can we share, and what can we grow from those ideas to make it apply into our community. There are 6 other regional prevention coordinators, and we are spaced throughout the state. Everybody has a matching region on the state map. So this is the team. If you haven't met your regional prevention coordinator, I definitely encourage you to reach out to them, get to know them. Great resources there. And with our Minnesota Prevention Resource Center, we have our program sharing conference coming up in October in Duluth. And just want to invite you all to it to hear more about what's happening. And it will be free to attend. So MEA weekend, October 20th and 21st in Duluth at the deck. And you can do that. And then the other part of that system that's been created by the Department of Human Services is the Substance Use in Minnesota Epidemiological Profile. And I just wanted to point out the risk and protective factor pieces on here and the amazing set of data that we can all utilize within our work, as that helps just to create those shared talking points and showing all the resources that we can collectively draw from so we don't have to silo. Like's been mentioned earlier, we also have through this system, there are positive community norms, previously called planning and implementation grantees at the community level, funded through DHS to work very intensively, build their capacity, and help them to implement substance misuse prevention strategies that are community driven and based on data and all the lessons learned. And that those go for 5 years at a time. And then the regional prevention coordinators, we also work with anybody that wants to do this. So it's everybody, and we pull from all of those pieces together. And we can come to you either through Zoom or in person or other methodologies. Our work is designed to come out and be right with community as we work alongside you. And then a note to highlight and give some credit, Melissa Adelson and Jacqueline Freund are on this meeting breakout right now, and they did a ton of work on the Substance Use Minnesota Epidemiological Profile, and is phenomenal and can share so many things with you. That also they've done stuff with family-wise, connecting ACEs and looking at substance use that way too, and really cool data sets just to help us make our work that much more effective at the community level. And our challenges kind of match everybody else's too, with finding different ways to reach people during COVID, and funding can be a challenge for different things. So we get very creative and a lot of partnerships. Thank you.
Language. Thank you, Laura. And Nancy.
Thank you, Laura. Thank you, Lindsay. I'm going to share something just to sort of break things up a little bit. So I want to talk about, I'll give you a metaphor for change before I go into any kind of detail about what the Department of Education tries to do in regards to systems change. At one time in this land that we call Minnesota, the prairie and the woods were just there. And there was an enormous diversity and many different kinds of animals, and people lived off that land. And the people that were here lived with the idea of trying to be in right relationship with each other and with the land that they were living on. And then when the settlers came, part of what happened was that there was a work to take this very, very rich land and use it to create a lot of food. And in doing that, though, to be able to have an enormous amount of food, what happens is that the land becomes used just as a monoculture. The diversity is gone. And that may create a lot of food. You may be able to grow a lot of food, but it also has some real downsides, and it makes over years, the soil less resistant to drought and to erosion, and it does not have the ability to capture carbon in the way that it did when it was in its natural state. But to be able to move from the monoculture back to a prairie state where you have a great deal of biodiversity and different kinds of work takes a lot of time. You'll see in this picture, there's a little oak tree growing on that land. And so when we're thinking about systems change, I think it's really important that we remember that it took us a long time to get to this state that we're in, with the diversity, with the challenges that we have, and it's going to take a lot of time to undo that as well. We're going to need a lot of persistence. We're going to need a lot of intention, and we're going to need a lot of patience. And so, yeah, so I think I was getting ahead of myself about what it was that I was learning. What I can tell you about using restorative practices is that it is by its nature collaborative and community-based. If you're going to do it with integrity, that you just have to be working with other people. And it is not something that sits within the realm of just schools or just the criminal justice system. It is something that is anywhere human beings come together. One wants to be in right relationship if you're going to be able to work well. And restorative practices really clarifies what is needed in order to be in right relationship with people so that you can work well, in my experience. Speaking, of course, as a white, cisgender, middle-class woman. So restorative practices and restorative justice and transformational justice intersect and connect and support and deepen work around trauma, around mental health. It is something that is connected in schools to social emotional learning and positive behavior interventions and supports, PBIS. It can be part of a trauma-informed school. I think one of the things that's really important to remember is that, like anything that we know in public health, it's best not to respond to trauma or big, high, bad illness, as it is to try to ensure that people are exercising and eating well and sleeping and being connected to other human beings. And so promoting positive relationships, teaching the skills of prevention, and then having different levels of intervention is going to take you farther faster and is going to help deepen the ability of a system to be able to respond in a relational way. And so when I think about the partnering that happens with restorative practices and the I can't think of a sector in the community that in some place I couldn't point to an example, whether that is in a faith community, whether it is in rural areas on tribal land, in small towns, mid-towns, in the urban center, in the suburban ring, not just in schools, but also in the criminal justice system. There are restorative justice councils run by inmates in prisons. Communities, people in communities meet. I know that there was some disruption that happened around the transition of power about when the events of January 6th happened, that reverberated through a small town. And in that small town, the people came together to try in circle to repair the harm. And they have been meeting on a regular basis, evidently, for about 2 years. And so while there have been grants from the Department of Education that help to spur schools to implementing restorative practices, the most recent one being the non-exclusionary discipline grants, and we've had school climate grants, and there have been other grants that people have gotten there where they have used that money to try to further deepen their restorative impulse and strengthen their restorative muscle. Generally, it is an offering, because a core essential element of restorative process is that you have to choose to go to it. And so that means that recognizing, changing the monoculture of a school is really important, because people have to decide. And any of us who have ever decided that we were going to, I don't know, take up exercise or stop drinking a certain beverage or whatever, you can decide, but then when you actually do it, that can sometimes take time. And sometimes you don't do it until maybe there's a little bit more discomfort connected to the non-decision that you've made. But it's stronger if a person chooses. Once you've made the choice and you do it, then it's more likely that it will stay. And so the department offers trainings. We have a very robust website around implementation, about the principles of restorative practices, about the practices, what they look like in schools. We provide technical assistance to schools around implementation. And then anybody who calls and gets a hold of me and they're looking for something somewhere in the state, we have some resources on the website. But I also am grateful to know a lot of people to be able to say, oh, you're in northern Minnesota? Well, call Lindsay. She knows somebody and she could maybe help you, or she could help someone else, or there's peacemakers, or, you know, there's folks in the Duluth area and the Cloquet area. And I know people down in, you know, by Winona, and oh, there's a whole bunch of folks in the criminal justice system on the western side of the state who work so closely with their community. I don't think whenever they've had a training, they've ever paid for any food, because people just donate because their relationships are so strong. Where am I going with that? I guess that the change is more organic than structural, because I have seen schools get money for 2 years or 3 years, or maybe they're lucky and maybe 4. And then when that money goes away, the activities go away. And so choice really is so critically important in order to be able to weather those ups and downs. Because ultimately what we're looking for is not something that is grant funded. We are looking for a mindset change, or the strengthening of restorative impulses that you already have, that then informs the way you act every day, which then has an impact on other people around you, which may eventually change the system. Pass it to Lindsay.
Language. Thank you, Nancy. All right, we are on to our third and final panel prompt of the day, just keeping track of time, which is a difficult thing to do as a facilitator. If I could ask each panelist just to try to limit their comments to just a couple minutes, so we do have some time for question and answer afterwards. So finally, we want to celebrate your successes with you. Please feel free to share any of those positive outcomes, progress, successes that you want to note. And most importantly, how can people get involved? And so Kelly, we'll start it with you.
Yeah, thanks, Lindsay. Like I mentioned before, we try to do things across the entire social ecological model, right? So there's a lot of good things that have been happening on like, how do we build our own skills to be able to keep ourselves well, right? Give ourselves the air first from the airplane before we help others, right? How do we do that? So we've got some really good wellness session things happening just to start normalizing. Talking about mental health is really our goal. Trying to start that culture shift. We also are providing a training of trainers or training of facilitators, still in the pilot process, for people to have those conversations in their community. So we will be offering that to the larger public after we get, through those bumps of trial and error. But really, how do we get this conversation to be happening across the state so that we know how to have these conversations around mental health? And then as things continue down that social ecological model, we offer many trainings, and I'll throw that into the chat through some of our grantees on like how to ask someone if they're suicidal, how to get people the help that they need. And then, like I said, we work not only with schools in the criminal justice system, but we also work with healthcare and behavioral healthcare settings across the state. And from a success standpoint, we have a lot of policy and system level change happening within healthcare and behavioral health to ensure that not only people get to the right person to get the appropriate care, but also follow up, which is a really big piece for suicide prevention and continuing mental health promotion. And those are some really good successes. The final thing of how to get involved too is we are in the very end of our first cohort for strategic planning, which goes over that course of a year. Similar to what's been mentioned before, we're working really collaboratively with those public health agencies that are having mental health and mental well-being as a part of their SHIP plan to say, how can these be together rather than separate? So that is something of partnership for things that are already happening across the state. But we're going to be probably opening up another cohort for that, for communities to come through. So lots of ways to get involved, whether you're an individual worried about someone, to system level change within some of those organizations at the community level. So thank you for allowing me to share that. I did already put my email into chat if anybody wants to get involved in any of those.
Thank you, Kelly. Chris.
There are literally hundreds and hundreds of SHIP activities going on. And so I'm not going to single out any one county, but I'm just going to talk about it in terms of settings. So you can get sort of the breadth of the work. Community gardens are abundant anywhere. There was one community garden that got workplaces to come and help support it, as well as volunteers in the community, and donate 100% of their stuff to their produce to the food shelves. So kind of a nice community organizing way to be able to, continue and give back, deals with a sense of purpose and all kinds of good things. We've been doing social emotional learning trainings with schools, trying to support schools, especially through the pandemic, and trying to give teachers skills for kind of self-regulation so that they can bring it back into the classroom. Hospitals are getting involved, walking paths, offering farmers markets on location for smaller communities that may not have one, serving healthy food in the cafeterias. Super shelf projects everywhere going on, a lot of super shelf projects around talking to people about ACEs and trauma-informed practices so that people can recognize The clients that are coming in might have some issues. How do you make it more welcoming, offering more diverse ethnic foods? Just again, trying to create more opportunity and allowing people to feel like they connect and they belong in those spaces. We've had a housing group did a really neat thing where they are training leaders in a Somali group that's predominantly a Somali housing situation that's predominantly Somali. And they are training leadership skills, creating a small board to try to help people have their voices heard within that housing. I mean, it's like a 200 person or 200 facility housing group, 200 unit. And then some of those leaders that have been trained have been able to share their voice in larger meetings within the community. And again, it's about kind of reducing the power structure and giving people voice to be able to show up. And then we had one county try to build ACEs capacity, first starting with their mental health providers and talking about that, then working with community leaders, and then working with the nonprofit organizations to try and help people really understand how to reach people who might have been traumatized as young, and then how does it show up in the work world later on, sometimes with performance-related issues or other things. So again, elevating capacity and trying to really make things happen. And some of our coordinators who've been here for 10 years or longer have such depth in communities because they've got the relationships. Again, people change behavior based on relationships, and work happens based on relationships. So any chance you get to increase your relationship capacity, I know it's outside of some people's comfort zone, but it really is the place to be. And with that, if you would like to create a relationship with a SHIP coordinator, I will drop in the chat the website location on MDH that talks about contact your SHIP coordinator. So every county and or community health board has a SHIP coordinator that you can reach out to, learn a little bit more about their work. Many public health departments have a SHIP section on their websites. We know that many SHIP folks are running Facebook pages, some Instagram. So many ways in which you can kind of be more familiar with SHIP work and see how that's happening, and either pitch in and help out or tie your work to some of the sustainability efforts that they're having. So that's it.
All right. Thank you so much, Chris. Much appreciated. Laura.
For us, a success and like one of our big hopes is, and it's a collective effort with pretty much everybody in this contributing to it, that most youth in Minnesota do not misuse substances. However, we know there is still the occurrence of it, and that's why there's a concern and why we do our work to create these changes around it. And within that, some of the biggest successes and celebrations that I'll highlight in the Northeast region where I work is we have different efforts on the Iron Range with the Cape Coalition and other partners. We're doing strategic planning in collaboration with the partners that are working on the Thrive Range and other suicide prevention efforts, which is super exciting to have those inputs coming together. And it also includes the SHIP staff that are a part of that. And then in Carleton County, we have the Carleton County Collaborative and all of their work with them and Reach Mentoring that is leading through with the restorative practices and incorporating it into everything they do. So it's a normal part of any work we do is their circle to begin and end trainings and work groups and meetings and stuff. So it's an awesome piece to have for me, to see all of that interconnection happening, because I feel like that's where we've been most effective. And then let's see, just to add out other pieces to be involved with any of this, reach out to myself or any of the regional prevention coordinators. We can connect you to coalitions throughout the state if you want to work more on substance use prevention. Also, it's in the chat now. I definitely encourage you to come to Duluth. It's an amazing city. Make it a vacation weekend if you can. I am a little biased because I do live here, and but program sharing is free to attend to and also to exhibit. So I would love to have all of you sharing what you're doing with stuff where people can hear about it too. Thank you.
Thank you, Laura. We'll turn it on over to Nancy.
Thanks. Thanks, Laura. Thanks, Lindsay. So I have two stories, very simple. One came yesterday at a training that I was at where a social worker said that there was a little boy in an elementary school who was dysregulated because he had some kind of medical diagnosis, a condition that required him to take certain medications, and the medications were not working very well for him, and he was disruptive in the classroom. And so she went in with the little boy and the rest of the class, and they sat down and they talked about what was going on with him. He was very vocal about it, so it wasn't as though there was a violation of data privacy. He was responsible for his own information, and they worked out how they could help him and gain more information and more empathy and more understanding. The other story that I have to tell is at kind of at the opposite end of things. Lorraine could probably tell me which prison it is. In one of the prisons in Carleton County, the Restorative Justice Council there of inmates invite in educators, particularly administrators who make discipline decisions, to come in and sit down with them and have a conversation in circle about what everybody's educational experience had been like. What was it like for them being in school? And one of those people was really, he was invited, he was taken by it, he learned about restorative practices, he became a practitioner, he started to try to influence what was happening in his schools, both as an administrator and then later as a teacher. And now, thankfully for me, he is working for the Department of Education. And so the interesting fingers, if you will, of relationship practices, as Laura just illustrated, show up everywhere. And then what can you do? Well, you can certainly learn more. That's always helpful. But I would just ask everybody to do these three things that some youth said back in the last century, that what was really important to them, whether they were teenagers or young kids or little toddlers. Smile at me, call me by my name, the name I want to be called, show interest in my life. And everybody can do that because everybody runs across some teenager somewhere, some little kid somewhere. And so, miigwech, back to Lindsay.
Oh, miigwech, Nancy, that's beautiful. And sometimes, we as adults overthink things, right? But that power of connection and relationship is so real. And that is a beautiful reminder of that. So thank you for that, Nancy. We do have some remaining time for questions. There was already a question posted in the chat towards Kelly. If Kelly could talk about 988 as a systems change and what that rollout will look like and what that means for all of us.
Yeah, absolutely. So a month from today, July 16th, all of our cell phone providers have to have 988 as an option for people to call. What that's going to do is we already have a system in place called the National Suicide Prevention Lifeline, which has an 8-digit number. And what we're trying to do as an entire nation is to say 988 is a lot easier to remember. So that change will go into effect for that 988 number coming July 16th. So how can we help? A couple of the things that we are doing as a state. So each state has the ability to determine what's best for that state. So we have four call centers across the state of Minnesota. So all of those phone calls to 988 and or the current suicide prevention lifeline number goes into one of our 4 call centers in the state. And we're working on getting their capacity up because not only are they going to be able to answer phone calls, but they're also going to be able to do chat and text. And so what can communities do? Help us by holding off on promoting that 988 number until we are ready. We want to make sure that if people are in need, that they get help. And so we're trying to get our call volumes up as well as getting more workforce development for those call centers to be able to answer what we know will be a higher rate of calls for help. And so we will be putting together a communications toolkit for each community to be able to help us with that promotion. That will include website stuff, like we'll have a website. We will also include logos that you have the ability to tailor and put your own community information on it. And then also ways to help us get that information out through email, social media, et cetera, with examples. So that will be coming. We will definitely be looking for everyone's help to help us get that new number out.
Thank you, Kelly. Much appreciated. Now I want to open the floor up to other questions.
I have one question.
Yeah. Thanks,
I
Lisa.
just wanted to a little clarification, because I was typing up some things as she was talking. So the 988 number, is it for mental health, did you say, or am I mistaken?
Absolutely. So it's going to be the same system as the National Suicide Prevention Lifeline, but the new name of it will be 988 for crisis and suicide prevention. So all mental health.
You know, language matters so much. And I know Kelly and I have had conversations too about folks maybe not feeling like their crisis or their particular problem meets the standard, right, of reaching out for help. And so I so appreciate the shift that's being made there, right? That is systems change. And I appreciate that being highlighted here. All right, other questions, please feel free to either put in the chat or unmute and bring your voice into this space.
Lindsay, I have a suggestion. I'm going to call upon Lorraine Mickelson to talk a little bit more about the Moose Lake folks. If you're willing to do that, Lorraine, sorry to put you on the spot.
Oh, absolutely not. I am happy to promote this amazing program. For actually probably a couple of decades now, the Minnesota Department of Corrections has really done a lot of amazing and wonderful work in the field of restorative justice by opening up opportunities for incarcerated men and women to be part of a restorative justice program, actually in all of the state-run prisons that we have in Minnesota, which there are 11. And it also extends to staff that work at the prison as well. But there's a lot of foundational training. There's a lot of activities, work, promotions, circles, lots of different events that they do throughout the year to promote this idea of restorative justice. One of the things that came out of the restorative justice program at Moose Lake was this idea of, you know, how do we connect with youth in our community? And many years ago, we had a program called Reality Check in partnership with the Cotton County Restorative Justice Program. We would bring youth into the prison to speak with the men about, you know, this pathway of kind of criminal activity and how you can end up, you know, inside the justice system. And so what happened with that then is, because of course many of the youth we were bringing into the prison were connected with a school, we thought, you know, why don't we start bringing in teachers, administrators into the prison and develop this program called Inside Out. And so the men at the Moose Lake prison facilitate a circle led by them, and they invite in, whenever they get the opportunity, people from the school system to really talk about that school to prison pipeline and how it can impact youth in our state and in our country. So it's not just limited to school systems. Anybody, no matter what capacity you work in, can be invited into the prison. And if you get a hold of Chrissy Gamst, she'll connect you up with the next time that they're going to have a program. I can't tell you the number of people that have been in circle with these men who share a story like nobody can. And they're so deeply, deeply committed to restorative philosophy and their own internal work. We just learn so much from them every time. So please reach out to Chrissy and join into the next circle that they have scheduled. thanks Nancy for letting me promote that.
Miigwech, Lorraine, and Nancy for that suggestion. I think systems change often begins with an individual shift in mentality and perspective, right? And then when we get those champions really working for change at other levels, that's so powerful. And I think the best way for us all to connect, right, is to sit and listen to each other's stories. So I so appreciate that being highlighted. We do have
There's a question in the chat.
Mhm.
And if you can answer it around the 988 number, and when do you think Minnesota will be ready?
Mhm. Yeah, that's a great question. So all of the carriers, like I said, the number itself will be ready by July 16th. So like the 988 number will be active for all carriers. That was the FCC's deadline for making that available. As for when will we be ready, we're at about 80%, maybe a little bit less of all of our calls actually being answered in state. Our goal is to get that to 90% before we start like formal push out, just because we want the calls to be answered in state so that we can get local resources to community members that are calling in. When they are answered out state, they don't have all of those resources. So that's really the reason that we're like, hey, it'll still be there, but we want to make sure we have the capacity so that when people call in, that we're not just de-escalating, but like full on supporting and providing that follow-up to make sure that they get the proper support rather than just that de-escalation service. So I don't have an exact date, but like we are pushing, and our call centers, they are rocking it. They are like doing the best to get their workforce up and ready.
Thank you, Kelly. That approach makes so much sense, right? I think, again, that fits also with what we've been talking about allowing communities to guide their own process, and having those more localized call centers, I think is going to make such a difference as well. So we would.
Yeah. SAMHSA is actually suggesting that we don't publicly start advertising it for another year, but we feel we'll be ready before then. So our plan is to get it fully up to capacity as soon as we can.
And as we all know, those services are so needed across our communities. Thank you for that. Being mindful of time here, I just want to thank everyone, our panelists especially. They've also put many resources as well as contact information in the chat. That information is also available on our website, the Gathering website. So thank you all for joining us today. Our next session of this event is the Collaborative Coordinator Special Session, which is offered specifically for Children's Mental Health and Family Services Collaborative Coordinators. Otherwise, we will be holding the afternoon breakout sessions from 1:30 to 2:30 after a lunch break. So in the chat, you can find access to the links for the remaining sessions of the day, as well as a link to the event webpage. So chi miigwech to all of our panelists and to all of you for coming and being a part of this session. And we'll see you again soon.
Miigwech, Lindsay, thank you so much for the invitation, and thank you all.
Yes, thank you to all the panels. This was great. Thank you so much. We'll see you later this afternoon.
Thanks,